Everything changed. Nothing is the same anymore.
You'd be hard-pressed to find words summarizing the past year better than that. Jobs were lost, stores were shuttered, and the little things, like visiting someone in person, were deemed unsafe.
It's hard, I guess. You know, we're social beings. We interact with people. We want to be around people. So losing that aspect of humanity was very hard.
Even harder for this man, who preferred we not identify him due to the sensitive nature of the story. Pre-pandemic, he'd be in the now empty dining room, taking advantage of the meals prepared in the now desolate kitchen, or gathering with community on one of these couches that haven't been touched in months.
It affected the entire system of the services that were offered here.
Here is the group once known as the Gay Men's Health Crisis, that now just goes by the acronym GMHC. In 1981, it became the world's first HIV and AIDS service organization.
HIV and AIDS, it was known as something else then, was literally decimating the gay community.
40 years later, it may be a new virus that's forced them to close their doors, but the parallels between the two can't be ignored.
And what the COVID-19 pandemic is highlighting is something that the HIV community learned 30, 40 years ago. The idea that people of color, poor people, and marginalized populations are disproportionately impacted.
While data is limited, surveys have indicated that marginalized individuals in the LGBTQ community are faring worse than their counterparts. A poll from the Kaiser Family Foundation published in March found that LGBTQ households have suffered job loss at higher rates, and nearly 3/4 of LGBTQ individuals say pandemic-related stress has had a negative impact on their mental health. That's compared to 49% of everyone else.
LGBTQ people are almost twice as likely to work frontline jobs.
Anthony Fortenberry is the Chief Nursing Officer at Callan Lord, a community health center that focuses on members of the LGBTQ community.
So it's been really important that we provide adequate testing, that we are doing check-ins for patients that maybe aren't able to come into the clinic because they are immunocompromised.
You could argue that not since the 1980s have the support services these organizations provide been as needed as they are today. And yet, those services are now harder to fund than ever before.
A year before COVID, we brought in about $4 million at AIDS Walk, and this year a little less than $2 million.
We're going to have a loss of around $6 or $7 million.
We had a $4.5 million revenue shortfall.
The heads of 3 of the biggest LGBTQ-focused nonprofits in the country, GMHC, Callan Lord, and the LGBT Center, say restrictions on face-to-face gatherings have had the biggest impact.
A lot of our fundraising is based on getting the community together in a room in some way and celebrating and raising money, and we have not been able to do that for a year.
Our financial situation started to be in distress really just days into the pandemic, as we started to see fewer patients and be able to do less billing for the visits.
You can't help but think there are people that we aren't able to help because we
don't have the capacity, yeah. We don't have adequate capacity to both provide care to everyone who's seeking it from us and provide vaccinations to everyone who's seeking those from us.
But while financial support may be severely lagging, the human support, like the sheer number of hours put in by staff and volunteers, has skyrocketed. For instance, Callan Lord, despite the challenges, still opened up its Brooklyn location, its largest facility yet, in the midst of the pandemic.
Now we're open 5 days a week, and we're just going to keep growing because the need is there.
Especially the need for mental health care, says the LGBT Center's Glenda Testone.
Because we serve LGBT people who typically face some kind of isolation to begin with, whether it's at home, in their job, in their neighborhood, not being able to be fully themselves, we just knew that this was going to hit our community hard.
Like so many, they've pivoted to all virtual assistance, but to their surprise,
we have actually been connecting with even more people than we did when we were in the building. So some of the services we provide, like individual counseling, support groups, the demand for those things has gone up anywhere between 25 and 40%.
And remember those empty dining rooms at GMHC?
We have come in to help out with packing the pantry bags for the clients.
They too have found a pivot. Thanks to a grant, they've been able to buy surplus produce directly from farmers upstate.
Every Wednesday, we do a grab-and-go food distribution. We do it from our lobby just to maintain social distancing.
It's not quite the same as gathering around a table, but it is something.
This shows our clients that we're still here.
You know, we were born out of an epidemic, and so I think because we had that history, because that's been our mission all along, we were able to kind of have the motivation and the effort that you need and the organization to kind of be able to do that.
Regardless of what's going on around them, the GMHC, the doors of GMHC will continue to be open for them.
Figuratively, for now, but one day, literally.
Oh, that'll be a dream come true. That'll be awesome when that comes about.
Did you catch that? When, not if. In Midtown, Chris Welch, Fox 5 News.